Hello, Facebook friends. We're back again here on our Wednesday afternoon treatment at the offices of board certified plastic surgeon Dr. Delio Ortegon and Dr. Baumholtz. We have here with us today our lovely medical assistant Monica that will be doing a treatment today for sclerotherapy for our lovely little spider veins that we'll be showing you first. We've taken pictures of the patients, right? And I'm going to have Monica explain to you this treatment. It's going to be a treatment she'll be doing today after evaluating our lovely candidate. Monica?
All right. So today we're going to do a sclerotherapy treatment, which is a treatment for spider veins. Spider veins are these pesky little guys that, a lot of women and men too have them. Very common in runners, nurses, retail, people who spend a lot of time standing or pounding the pavement running. Elizabeth is a runner, so she's
Hi, Elizabeth.
She's got the spider veins. She's a great candidate. So what is sclerotherapy? Sclerotherapy is injections. We inject straight into these veins that are very superficial, right under the surface of the skin. So we're going to inject a solution that is very dehydrating. The solution that we inject is a hypertonic saline. The hypertonic saline has a lot of salt content in it. So what does that mean? It's dehydrating. What's going to happen? It's going to dehydrate these veins and eventually collapse them. Just by evaluating Elizabeth, I would say she's probably going to need about 3, possibly 4 treatments. We span those about 6 weeks apart, and the maintenance in between is going to be compression. Compression is key when it comes to the aftercare in these spider veins. Here is a sample of the compression stockings that we use. It's very thick, it's very tight. It is hard to do this treatment. We live in Texas in the summer. Now is the best time to start treating your spider veins.
So winter is the best time to do it because you can cover up.
Yes, fall, winter, those are great times to treat because you're going to be in these really unattractive compression stockings, and it's hot. These things don't breathe all that much, and then also you want to stay out of the sun after the treatment. Anytime we enter a vein, we can you might have some bruising.
Where's the most popular? I have a question from the audience. Where's the most popular areas or the most areas that you'll see spider veins appear? And does it appear in all ages?
It can. I have treated somebody as young as 18 who has been an avid runner, and she was even a gymnast also. She had spider veins that you would not imagine belonged on an 18-year-old. But the most common area to treat is going to be the legs. Legs are the most popular place that I've seen. However, people do get them on their face. They do get them on their nose. Sometimes they even get them on their breast. Women get them on their breast. When it comes to the face, I typically like to treat with laser. So, coming in for a consultation is the best way to determine what treatment is best for you. Just because the skin on the face is quite a bit thinner than on your legs, that will make you a better candidate for the laser, and typically the ones on the face are a lot smaller. That's going to make you a candidate for laser. We could probably still laser the ones that Elizabeth has on her legs. However, she's definitely going to have a better outcome if we treat with injections.
With injections. And what type of needle do you use for the injections?
It's actually one of the smallest needles, because that's a very common question. Does it hurt? This is a 30 gauge half-inch needle. So it's tiny. So yes, it's a needle. Yes, you're gonna feel the poke, but the treatment goes pretty quick and it's really tolerable. I've never had anybody stop me.
Do you numb the patient before injecting, or?
Topically, I do not, because when it comes to the legs, people have different areas, and we don't want to use too much numbing cream. However, I like to be very nice and mix in a little bit of 2% lidocaine into my solution, and that really helps the process and the treatment go smooth, and it makes the patient more comfortable.
Excellent. And you've been doing this for many years already, and we've had some great results with our patients in-house. We always take a picture before.
Absolutely.
And will you see the results immediately? Like, will they notice?
Well, what you'll see immediately is you'll see the veins actually flush. So they will disappear upon injecting them. However, the blood will refill. What's causing the flush is that medication is in the vein. It is flushing out the blood. A little bit of blood will start to reappear and it will look irritated after the treatment. But you can see a pretty great result after about a week, and it only gets better from there. Again, I was saying Elizabeth is probably going to need about 3, possibly 4 treatments because of the darkness of her veins. She's got some darker purple ones in here. So those are going to be the ones that are going to be most stubborn and take the longest to respond. But I think she's a great candidate.
And what causes them these spider veins again to appear? Just long-standing, you said, or is it hereditary?
They are hereditary. So most of my patients that I've treated do report that their mom has them, their dad has them, their grandma even before had them. So heredity is going to be a pretty big factor. And then what you do on a day-to-day, like I said, nurses, retail, runners, big time.
People who are on their feet.
Yes. People who spend a lot of time on their feet and who are, hard on their legs.
And you said men get these too.
They do. When it comes to men, it's going to be the ones who work out quite a bit. Also, heavy set men. They have a lot of weight to carry and, a lot of pressure on the legs. We do see it in men.
Okay. Should we
All
get
right.
started?
Let's
Awesome.
do it.
Again, you are with us at San Antonio Cosmetic Surgery, the offices of Dr. Delia Ortegon and Dr. Michael Baumholz, board certified plastic surgeons. This is Monica, our certified medical assistant, who's been doing sclerotherapy and treating veins with laser and injections for many years now. Elizabeth is our lovely model. She is one of our staff members. Thank you, Elizabeth. We hope everybody had a lovely, lovely holiday.
All right. Do you have a good view, Jen?
Yes, I do. We're going to get a really good close-up, and we're going to see.
So right now I'm just kind of
Injection.
cleansing Elizabeth's skin. We want to make sure that, she doesn't have any lotion or anything to the surface of the skin before we start injecting. Let's see. So I told you these veins are very superficial, right under the surface of the skin. No, I'm good. Alrighty, Elizabeth, you ready?
Yes, I'm ready.
I always like to warn my patient right before we start, we are ready. So right under the surface of the skin,
Beautiful.
you can see that start to fade right before your eyes. And it is moving up. So I will move up with it. I'm going to try to target it from a couple of different areas.
Now, when you come in for a consultation, Monica will go over with you her recommended plan. So you don't have to do it all at one time if you have many areas. You can see that we'll be treating Elizabeth over the course of the year, probably.
Yes. So we'll do her next treatment in about 6 weeks, and you can see the area that we've treated that started out really dark purple has already started to lighten. It's got the solution in there. From here, it's only going to do its job, which again is to dehydrate, and eventually it's going to collapse these veins. Now that's where the compression stocking comes into play. We want to go along with that collapsing of the vein, so we have that compression right on top of the vein to keep it from opening up and pumping full of blood again. So I am going to move on to another area a little higher up. And
how are you feeling, Elizabeth?
I feel fine.
Can you feel that poke?
Not really. It's kind of like maybe like a mosquito bite. Just
that is a very common answer.
really feel like anything unusual.
Now, we do offer our patients a little coolant spray, I think, on occasion, if that's what they prefer.
Yeah, I mean, we definitely can take, certain measures if somebody is uncomfortable, but Elizabeth is tolerating the treatment very well. So I am going to move on to her other leg just to be able to show you one more time how great she is actually responding, and then we'll move on to finish her entire legs. So I'm going to come to this area now, certainly not as bad as the other veins on her other leg.
She's not as vascular on this leg as she is on the other. There's probably a lot less treatment on this side. Is that correct?
Mm-hmm. Absolutely. So a lot of people think, you know, like, oh, my veins are too small. I don't think you'll be able to treat.
Oh, wow, that disappeared immediately. Oh my goodness, that one just went away right immediate.
So that's why we use such a small needle. Just
Is there any preparation that you have the candidate come in before? Is there anything that they shouldn't do before they come in to see you, or they can't do afterwards?
not necessarily before. However, afterwards, we're going to stay away from running, any vigorous activity that, you know, no leg weights, no running, things like that we'll want to stay away from.
For how long?
For about a week and a half. So you're in the compression stockings for about a week and a half after the treatment. And as long as you're in the compression stockings, I really don't advise that you do any running or any leg weights or anything like that. Also, no tanning, no sun exposure. We want to stay out of the sun and not expose these areas to sunlight or UV light, just because they can actually darken. So if you expose these areas while they're healing, then you can actually permanently discolor your skin. Okay, so we'd love to have you in for a consultation. We can determine if you're a better candidate for laser or the sclerotherapy.
So this is a picture of her.
Yeah, the glare is on. There we go. These are the pictures. Look what I'm seeing on my phone. These are the pictures of where we started. This one is before. This one is after. You can see it does, like Monica mentioned earlier,
It becomes a little irritated immediately after we treat it. However, that purple hue that you saw initially already has lightened up. So it's pretty important that we get her in her compression as soon as we finish the treatment, because we want to keep that pressure on those veins.
excellent. Now, you can come in for a complimentary consultation with Monica. She can determine the best vein treatment plan, whether it's going to be with our laser or with the injections. How are you feeling, Elizabeth?
I feel fine. Okay.
Excellent. Awesome.
All right, so don't forget to like us on Facebook, like always, Monica. Now we have someone that you can come in and talk, and like I said, it'll be a consultation. You come in, she'll see you, she'll consult on you, tell you how many treatments you need, which is the best treatment, whether it is the sclerotherapy or it is our laser. Call us at 210-614-4320. Ask for an appointment with Monica. Remember, we're San Antonio Cosmetic Surgery Center. Let us know how you like us at the office, what any else we can do for our next Wednesday. Again, San Antonio Cosmetic Surgery. If you have any questions, Monica, anything you can think of that they need to know, if they want to ask?
No, not necessarily. You know, it's really hard to I mean, answering questions, absolutely. That's what we're here for. But yeah, and actually seeing the patient, that's going to be the best way for us to determine what treatment is best for you, how many treatments you're going to need, and how far apart. How long is our treatment plan going to take us?
Because there are some veins we do not treat, but we can determine that during your consultation.
Absolutely.
Whether a vascular surgeon or a vein specialist needs to look at. We also have our doctors here that can give you their input as well.
Definitely.
And we will have another live stream next week.
Next Wednesday we'll be doing our IPL with Amy. She will be treating redness in the face. So IPL will be the choice next Wednesday at noontime with Amy, our esthetician. She'll be treating our redness in the face. Again, another treatment we can do during the winter time, fall, when you're away from the sun, no soccer, sunscreen. Give us a call if you have any questions, want to make an appointment, talk to us about any of our treatments. Again, 210-614-4320. Like us on Facebook. Make sure you throw in those questions. Anything that you'd like to see, always, Genevieve's always really good about picking up.
I do have a question.
Yes.
They want to know, what is the cost of something like this? Is that just determined during your consultation? And do laser and sclerotherapy Are they interchangeable? Are they separate pricing or?
They are separate pricing. So again, that will be determined at your consultation, because we do price them in 30-minute packages. However, if you come in and you are covered in spider veins and we determine it's probably going to take you 2 sessions of 30, that's how we'll determine that upon seeing you. So the price can vary from patient to patient, and then again with the laser will just depend on how many treatments you will need. And typically 30 minutes is plenty of time to perform a laser treatment, just because it's a lot quicker. We're just running the machine over the veins.
But the average cost is maybe per 30 minutes?
It can start at about $300 for a package of 2, and it can go up to about $600. So anywhere from $300 to $600, depending on the severity of the veins. Now that's a package of 2.
Awesome. Now we are offering complimentary consultations for our Botox and our facials, and
we still have the end of the year for everyone. Still, I get the calls. I'm trying to work as hard as I can to fit you on my schedule. But please, if you even call in and prepay your Botox at $9 a unit, Juvederm, Volbella, Voluma, all $200 off. If we will honor it until the end of the year. If you can't get in to see me before then, you prepay it online, and then I'll make on our call, you could prepay it, and then we'll just schedule you for January or February when it works for you. Please remember, Brilliant Distinction Points. We'll do all the legwork for you. We'll get you started on that. We're working straight through till Friday. If you want to make it before the New Year's Eve and have your beautiful luscious lips or your mid-face, I'll get you started. If we need your Botox to kick in 3 days, we'll definitely work my best to get you in here, okay?
And our Christmas special still applies. So give us a call. We'd love to hear from you and hope to see you soon. And everybody have a lovely, safe, prosperous new year.
Don't forget San Antonio Cosmetic Surgery, Dr. De Ortegon and Dr. Baumholtz, board certified plastic surgeons here in our office. All the staff, we wish you a safe New Year's Eve. Genevieve, anything you'd like to say before
Nope.
we end?
Everybody have a fabulous new year.
All right,
Love
take
our
care.
staff. Take care. Bye.
Bye.